Being a paramedic, you have a chance to get out there in the community and save people.
Open your eyes.
Where's Mum?
They're in their darkest hour and they just hand you all their trust and say, here, you help us.
Our priority is just to make sure that you're okay.
I really enjoy going to someone and turning that frown upside down.
Give me a big smile.
We've got you.
Delivering a patient to hospital in a better state than what they were in is phenomenal.
He'll be all right.
Mum, I love you.
They're like angels.
That's it. Stop CPR. He's got a pulse.
Being a paramedic has taught me life is precious and you shouldn't take a second for granted.
Michael, open your eyes, mate.
On this episode of Paramedics, Cam and Dodsey try to save a normally fit young man
Leave that on for me, Michael.
who's suffering a severe seizure in an ice cream shop.
This would be very traumatic for the patient's parents and his girlfriend to see. For all they know, he could be dying.
Happy.
What is causing this patient so much distress?
All right.
I don't know what to do next.
That's all right.
And Steve works his charms on a frightened 20-year-old.
You like me to talk?
Yes.
Don't stress, mate.
Sorry.
Don't stress. Oh, mate, I love a chat.
He's got that ability to make people feel at ease, and this is what makes him a brilliant paramedic.
A balmy evening in Melbourne has brought people out in droves. But a warm night can also spell an increase in calls to the Emergency Services Telecommunications Authority. For one family, the night has taken a drastic turn.
Emergency Services.
We've just had a first-time seizure at the ice cream store.
So can he respond to you at all now?
No, he hasn't yet.
Mobile intensive care paramedics Cam and Dodsey waste no time heading to the unresponsive patient under lights and sirens.
Mike City, it's a 8-year-old male, first-time presentation of a seizure, and it's just re-seized.
30 received.
The dispatcher said there's an ambulance on scene. Patient was postictal and now has had another seizure.
So postictal is a term that we use in patients that have had a seizure but not fully recovered. If he has continuous seizures, this could lead him down a really nasty pathway to he could actually cardiac arrest and he could die from it.
So he's not diabetic. He's not an epileptic. Does not have a history of stroke or brain tumour.
This is a real concern. I mean, there's a lot of things that can cause seizures themselves, but for somebody to just drop and have a seizure, it's not normal.
Causes potentially some kind of neurological component, whether it be a growth in the head or a bleed, drugs or alcohol, big one.
Yep.
Possibly trauma.
Yep. Yeah, Micah 30. Any updates on the patient?
Michael has had 3 generalised seizures. He currently has a spontaneous respiratory of 18 with resetting and maintaining respiration.
Great, mate. We'll see you soon. Thank you.
So we give them oxygen because when they seize, they don't breathe. That's when they can get damage in their brain. And the brain needs that constant flow of oxygen. So alarm bells are ringing for us.
I'll bring the airway bag.
Hey, mate.
Hey, guys. Here you go.
This is Michael. 3 episodes of seizure activity, the last one at 19:55.
Yep.
We've admitted him a dazzling of time, which caused his seizure to stop.
When we arrive, there's a level of chaos to the scene. The other paramedics are controlling things in regards to maintaining an airway on the patient and assisting his breathing. They've done a lot of work in a short period of time.
What's his name?
He's at Michael. Home respirations with PVM ventilations, which
Okay.
back up to 100.
Perfect.
It's all right, mate. His girlfriend is outside and his parents are there.
Sure.
Parents are there. In the black dress is his mum.
Just find out anything leading up to this or what his day's been like.
And this would be very traumatic for the patient's parents and his girlfriend to see. Their fit, well relative has dropped and had seizure activity in front of them, and for all they know, he could be dying.
Just relax, buddy. My name's Paul. I'm from the ambulance. Leave that on for me, Michael.
Emergency Services.
I can't breathe properly.
Are you home alone?
Yes.
Okay.
Yes.
I'm meant to be isolating.
A 20-year-old has called the Emergency Communication Centre in extreme distress and gagging for breath. She's currently waiting on results of a COVID test.
I'm scared.
Yeah, I understand that you're scared. You're doing a really good job, and I'll be here right with you, okay?
Thank you.
RC139.
RC139, who should be breathing from code 1, you'll be back to Margaret's on the down channel.
139 received.
Steve and Jade are dispatched to support a Micah paramedic who's also en route.
Clear left.
Yeah?
Safe to proceed.
Thank you.
Breathing problems are probably the most serious thing that we can go to in the ambulance. So it's really important to get there quickly and find out what we're dealing with.
20-year-old female, struggling to breathe. Patient is coughing a lot in the background.
Suspected COVID. Oh, poor doll.
So I had COVID earlier this year.
There's Micah there.
As COVID is showing all of us, it evolves very quickly. There were points that I thought maybe even I need to call an ambulance.
Knock, knock. It's just Steve and Jade.
Hi, Steve. Colin. This is Jade. Probable COVID.
Yeah.
She's coughing.
When we walk in, Jade's sitting on the ground. She's kind of using her whole body to take a breath in. And I'm worried about the sound that I can hear coming from her throat.
She's really heaving with her breathing and looks like she's in some strife.
38-year-old Michael was out for an ice cream with his girlfriend when he suddenly collapsed, having multiple seizures.
So young, fit, healthy, no drug use.
That's where we're at right now.
Cam speaks to Michael's girlfriend May and stepmum to see if they can shed more light on what happened.
I'm his partner.
Oh, okay. My name's Cam. What's your name?
I'm Debbie.
Hi, Debbie. Well, can you tell me about him?
To the bathroom.
Oh, sure.
So
What can you tell me that they might not know already?
He's super healthy.
Sure.
He went for a run this afternoon.
No headaches or anything of late? No medications he takes? He's not allergic to anything? No. He hasn't seemed more confused or anything of late?
Just 2 minutes before it happened. And I asked him a question, which I already knew the answer to, and he gave the wrong answer. And I'm like, are you okay?
Yeah, okay. Our plan is to continue to just support his airway and his blood pressure and heart rate for the moment.
I want to reassure them that we're going to look after him. We're going to do everything we can to protect him.
Leave me with it for a little while. I'm going to run my eyes over him, see what these guys are up to, and we'll keep you posted.
He's been given some medication to sedate him to drop the seizure, but some people still wake up after that medication and after a seizure, and which is a bonus because they're able to wake up, sit up and protect their own airway. But he's not waking up.
He's a really fit bloke, as you can
absolutely.
see. He went for a run today, he hasn't had any complaints, nothing at all. He was talking and then just became vague off into the distance and boom, went down.
Michael, can you open your eyes, mate? Michael, open your eyes, mate.
And we're waiting for Michael to come back out of these seizures to normality, but it's just not happening. Yeah, so something really serious is going on in Michael's brain.
It's okay, mate. Let's get him in the truck.
So we need to get Michael moving because treatment for Michael on the floor of an ice cream shop in front of a host of people and family is quite distressing.
You go and set up. I've got enough hands here.
Okay.
We need to get him onto our stretcher and we need to get him into the back of our truck.
Tell me when you're ready, guys.
The plan at the moment is to put him in the truck and see how he goes. If he's still requiring assisted ventilation, we're going to paralyse him and put a breathing tube down, okay?
Just relax, Michael. Good man. Good man.
She was hyperventilating, which was exacerbating it when I arrived. So as she continues to breathe harder, obviously it makes it worse.
Steve and Jade are backing up Micah paramedic Cullen, who has made his initial assessment of 20-year-old patient Jade.
Jade's had COVID-type symptoms for the last couple of days, predominantly sore throat. Have you got paracetamol in your...
Yeah, mate, I got some in my kit. The management plan for Jade at this point is give some paracetamol for her pain, but the elephant in the room is symptomatic COVID, so I'll be closely monitoring her vital signs, making sure that Jade doesn't get worse.
I'm just in the process of finishing assessment, but I think she's actually got some swelling around her vocal cords. She's got an inspiratory stridle.
Jade is experiencing something we call a stridle, which is a narrowing of the upper airway. If her airway continues to narrow to a point where it closes over, she won't be able to breathe anymore.
Has she tested positive on a rat?
She's had a PCR awaiting results.
Yeah.
So, the rat didn't work, did it?
It's negative.
Even though we suspect that what's going on has something potentially to do with COVID, we actually have to be really mindful to not kind of box ourselves in with that idea. So we need to get her to hospital quickly so they can figure out why this is happening. And hopefully she doesn't deteriorate in that process.
Just keep
Have we got a wheelchair?
Yeah, Jade's getting her bed in a wheelchair.
It's the ambulance, buddy. Cough for me.
Dodsey and Cam are trying to save the life of their 38-year-old patient, Michael, who fell to the floor of an ice cream shop having multiple seizures.
We can see that the patient's waking up a little bit, but he's not waking up properly. I'd say his brain is stunned because it's been starved of oxygen for a little while, so he's moving his body thinking, wake up, what's happening, I don't like this feeling, like trying to wake from a sleep, but you can't.
All right, let's start looking at moving, yeah?
While Dodsey gets ready to move Michael to the ambulance, Cam heads out first to get organised.
I start to prepare all of my airway equipment. I've also got to draw up all of the drugs. In case he deteriorates, we need drugs ready to sedate him, paralyse him and maintain blood pressure while we work on him.
Start ready?
Yep.
Go.
Awesome, good work. Okay, let's go up.
Lift up.
And let's get to the car.
Michael's girlfriend May and stepmum Debbie are still coming to grips with what's happening tonight.
So one of the things I'm always very aware of is the emotional state of the family. So they're seeing their loved one in a really bad state.
Just relax, Michael. Just relax, mate.
It's okay for me, I'm treating Michael, but they don't understand what's happening with him, so this is a scary time for them.
All right.
Step coming up.
Ready? Step coming down now. Go, Mick. Go.
So the drug we used to stop the seizures is wearing off on Michael.
Okay, nice and easy.
Which means his agitation is starting to increase again, and he's very hard to control.
Not the bed.
Hang on, Michael. Michael. Hang on, mate.
So a patient that is agitated can create a whole host of problems because with Michael thrashing about, he's increasing that pressure in his brain that could cause more damage.
Sorry, mate. I just want to get him settled. Michael, relax, mate. So let's put some ketamine on board.
He's just really
hypoxic.
Yeah.
And this time we give him a medicine called ketamine to reduce that stimulus and sedate him a bit so we can manage him in the back of the ambulance.
Oh, man, he's... Okay. It's just hard to hang on to him. Nice and easy, Michael. Nice and easy, mate. You settled?
Hey, Michael.
Just relax,
You're
Michael.
safe, mate. You're in an ambulance.
Just relax.
Okay. He's a big boy.
Absolutely he is.
So Michael's agitation and his irritability in this postictal phase has now gone on for way too long.
I think that we just need to RSI.
Let's do it. Done.
And the decision's made. We need to paralyse him and sedate him.
It's all good, mate.
You can give him another little bit.
You're doing really well, all right?
Steve and Jade are moving their 20-year-old suspected COVID patient out to the ambulance.
That's okay, but we're here now. We're here now, all right? Just deep breaths, because if you get upset, it's going to be harder to breathe. All right? Just relax, we're here now. I know, but we're here.
You're doing a good job.
Nice and slowly, Joe.
You right with that?
Great name, Jade. I'm just going to put some stickers on you, okay?
Yeah. Like, my roommate's gone, but He was isolating not long ago, so I think I got it from him.
So whenever we go to someone who has respiratory symptoms, one of our main concerns is how long have they been going like that for? Someone who's been shallow breathing and had an elevated breath rate for some time could be moving down the pathway of becoming quite unwell.
Can I just listen to your back? If you can sit a little bit forward, you can hold up onto here.
I'm going to put your top up.
Good girl. It's all right.
I'm going to lean you back.
Is it causing you pain somewhere? Just tightening?
It's just...
Here we go. Here. Slowly, 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 slowly. You're doing really well, all right?
Oh, Jade.
And then that will see what's great.
You're about to panic? That's okay. You're doing excellent, mate, OK? I just want you to really concentrate on the sound of my voice, OK?
Jade's dad, Nathan, has just arrived at the scene.
Jade, your dad's here.
Yo.
They're taking you to the hospital?
Yeah.
She's doing real well.
Thank you.
No worries, mate. We'll take good care of her, OK? So what we're going to do is we're going to load up. I think we'll get moving, OK? I don't think there's much benefit in just sitting here. So okay, we don't need to give you any medications. I think if anything changes, though, to the point where you're really struggling to breathe in and breathe out, then I'm going to become a bit more concerned, OK? All right. And when did you notice the noise in your throat started getting worse?
I was trying to cough a lot because I thought it was like... But because I kept coughing, I couldn't breathe.
Yeah.
I was also upset because anyone who's like seen me might have it, you know. I just felt bad.
Yeah.
I didn't even know I had it.
Jade, it's real tough, isn't it? It's like the nature of this pandemic is awful. Like you feel that guilt straight away when you think, gosh, have I gone and seen people that are potentially infected?
It breaks my heart that she feels guilty about something that she's got no control over.
But things are getting better, all right? I don't really want you talking much because I think that's going to make things worse as well, OK? As much as I'd love to sit here and have a chat. But is there anything I can do to make you more comfortable, Jade?
I know you don't want to talk to me, but...
No.
I'll just get my own head.
Yeah, so you like me to talk?
Yes, please.
Don't stress, mate.
Sorry.
Don't stress. Oh, mate, I love a chat. One of the non-pharmacological managements that we use is distraction therapy. It works really, really well. If you can take someone's mind off what they're feeling, you can make them feel better. When you feel anxious, you like to talk?
Yeah.
Yeah. That's a great coping mechanism, I think.
While I'm driving us up to hospital, I can hear Steve in the back having a really lovely, genuine conversation with Jade about life, actually nothing to do with the situation that we're in, and that completely calmed her down. His patient manner is absolutely delightful, and he's got that ability to make people feel at ease, even though they're in the back of an ambulance feeling rubbish. This is what makes him a brilliant paramedic.
We're just pulling up to hospital now, I think, from where I can see out the window.
Yeah.
Do you have any questions, Jade? No?
No.
Now that we're at hospital, Jade will see the medical team who will do further investigations to hopefully get down to the bottom of what occurred tonight.
Breathing issues is my least favourite thing, but that's okay. You did all the right things.
It's crunch time for seizure patient Michael.
Is he still going?
He's still combative and he's very strong.
Yeah.
His future, right now, depends on the skills of Dodgy and Cam to perform an emergency rapid sequence intubation that will take over his breathing.
Michael, it's okay. He is seriously strong.
Okay, I need a size 8 tube.
Cam can take over your side, and you heard what he's going to do, so you're probably Cam's airway man. Ambulance Victoria was one of the first ambulance services in the world to do RSI in the pre-hospital setting. So this is something that gives people in Michael's situation the best opportunity to good outcome prior to hospital.
So what we do is give somebody medications to paralyse them and stop them breathing. He's going to be 100% reliant on us getting that breathing tube in the right hole and then ventilating him to keep him alive.
So my plan is, I'm going to do a tube with a stylet in it.
Perfect.
And attempt for first pass.
Perfect.
If I'm unsuccessful, I'm going to move to X-blade with a bougie.
Okay.
And then worst case is plan 3. I'm going to use an SGA and ventilate him.
Okay.
Should I get into the situation where I can't oxygenate and can't ventilate the patient, we're in a crike situation where I cut a hole in the patient's neck and put a breathing tube in, and that is a nerve-wracking procedure.
So we've worked out that he's 100 kilo.
Oh, easy. Yep.
Righto.
That's rock.
Thank you.
And it's taped to it.
We give him a long-acting paralysing agent called rocuronium. What it does, it stops a person breathing. It means that they can't move, they can't scratch themselves, swallow, talk, anything. They're paralysed.
I'm just going to swap seats with you, so I'll get you to stand up and go that way, and I'll sneak in here. Thanks, mate.
All right, let's just all take a little breath.
Okay.
All right, you tell me when we're happy, mate.
Okay, I'm happy to drop drugs.
Righto, so I'm going to kick off with 100 of ketamine.
Yep.
And then I'm going to give him 100 of rock.
Sure.
Okay?
Sure.
Can someone just scribe those for me?
With girlfriend May watching on from outside the ambulance.
100 of rock going on board now.
Michael is given the drug to paralyse him.
On board.
So we put the drugs on and we wait for the patient to stop breathing.
Okay. So right now, SAT's 97, 118 on 70, heart rate's 95 and sinus.
Alex, can I give you that? Thanks, mate.
Once Michael has stopped breathing, Cam has only moments to insert the tube.
Righto.
Everybody has anatomical and structural differences within their airway. And you never know what challenges you might face.
It's quite deep.
In the back of an ambulance, Doddsy and Cam have just medically paralysed Michael.
Alex, can I give you that to hold?
So they can insert a life-saving breathing tube down his throat. Girlfriend May can't bear to watch anymore and has taken a seat in front.
If all goes well, there's between 60 and 90 seconds that the patient's not breathing. But with what's happening within his body, he might chew through all of his oxygen stores and his oxygen levels might fall very quickly.
Righto.
I open his mouth and introduce a laryngoscope.
Tongue.
Which is a tool to sweep the tongue to see if I can distinguish between the breathing tube and the eating tube.
I can see his epiglottis. It's quite deep. I've got a grade 1 view.
I see his vocal cords, and that's where I need to pass the tube between to ensure that it goes into the lungs, and when we ventilate him, we're inflating the lungs with oxygen.
Grade 1 view, sided pass go through the cords. Can you just pull the introducer back a little bit? Yep. But, I'm happy with that.
Happy?
Yep, that can come out. I've got confirmed waveform there.
Good work, Cam. Nice tube.
So, is everybody okay? Yep. Can you just let his partner know that the procedure went well?
That's 2111.
Thank you.
So we know his airway's safe. We've taken over his breathing. His numbers are all nice and relaxed now, but he's still not out of danger. We still need to get him to hospital quickly.
So,
all right.
Someone can drive us, but let's get going.
Yep, let's roll.
Yep.
Cam and I both travelling in the back of the truck with Michael is indicative of how sick Michael actually is. So we're still on high alert until we get Michael to hospital.
So, it's a really slow drive there, nice and easy, thanks. Yep.
He's still not breathing himself, so I'm constantly going to squeeze the bag to do the job that his lungs would normally do, and I'm going to do that all the way to hospital.
So Michael's going to need things like blood tests. He's definitely going to need a CT of his brain, and that could lead to surgery within the next couple of hours, particularly if he has a tumour or an undiagnosed bleed.
I hope he's got a good prognosis. He's a young, fit, healthy man. I mean, it's a waiting game for the family now.
So whether or not something organic or he's got an undiagnosed bleed or an undiagnosed tumour or something going on in there, or I don't know what else I could point it at.
Hopefully, the surgeons get on it early. Whatever is in there gets out, and the treatment's good, and he gets to live a good life. He gets to perhaps marry his girlfriend and spend more time with his family and enjoy the life that everybody should.
I mean, all in all, you know, right place, right people.
And he was fighting pretty hard. You had to hold him down.
I was sweating. That was a serious wrestle. I haven't had a good wrestle like that for a long time, mate. But look, hopefully a good outcome for him and the family. You know, young.
Yeah.
Good work, mate. Good job.
Thanks, buddy.
A new day and a new alarming call for help.
Emergency services.
Okay, so a lady, her name is Karen. Her heart rate is 170.
Okay. Just coming up as the Craig Rossi Clinic, is that correct?
That's right.
Micah 30 received code 1. 71-year-old female has come into a doctor's clinic with a fast heart rate of 170, it says. So that's quick.
The patient's heart rate is almost 3 times faster than it should be. So Micah paramedics Leonard and Cullen will be hoping to get it down to a normal range.
A fast heart rate in someone who's 71 years old, generally they can't tolerate as long as younger people.
There's only so long that a heart of that age can pump that fast. Eventually, it's going to get weaker. This could be life-threatening.
We're 800 metres away. We're literally on top of it.
Clinic, that's it. Bring monitoring bag.
Yep. I'm thinking, what kind of a state are we going to find this patient in? She could be dizzy, she could be complaining of chest pain, she could be unconscious. A patient with a heart rate of 170 beats a minute, I'm thinking they're going to be very unwell.
We're the ambulance.
Oh, that was quick.
Yeah, we were driving past.
You're the patient?
Are you the patient? Hello. We walk in and there's the patient we're here to see, and she's looking remarkably well. You're right to walk?
Yeah.
My name's Cullen. What was your name?
Karen.
Karen.
Even though on the surface the patient looks well and is acting really calm,
have a seat up there.
She's still got a heart rate that's way faster than normal, so we really need to be on the top of our game here.
What was the reason you came to the doctor?
I just had to get a prescription for my blood pressure tablet.
Yeah.
And my ankles have been swollen.
Okay.
And that was it.
All right. So the first thing we need to do is do an ECG just to confirm Karen's fast heart rate. Her heart rate isn't going 170 beats per minute. It's going about 183 beats per minute. You don't feel short of breath?
No.
No? I'm just going to listen to your back. We'll get a few vital signs.
Thank goodness her GP has been extremely thorough and checked her heart rate and performed an ECG.
Just take some normal breaths through an open mouth.
Because of that, the GP's diagnosed her with a really serious cardiac arrhythmia called SVT.
SVT is short for supraventricular tachycardia.
Is there a point today you can remember where your heart started going fast or anything like that? You can't remember a particular point?
No.
No, you haven't felt dizzy?
Nope.
Haven't felt nauseous?
No.
No?
So SVT is an abnormal heart rhythm where the electrical activity of the heart is basically spinning around in this one circuit uncontrollably at a rate of 170 beats a minute in terms of Karen.
But you didn't think all this was going to happen today?
I know.
We need to move quickly to get Karen's heart rate back to normal. She's been in this for an unknown period of time, and we don't know how much longer she's going to have before she starts having some really serious consequences.
How are the kids? The kids are great, Marley. They're growing up way too fast.
While good friends Taney and Marley wait for their next dispatch, they get to enjoy a bit of chat time.
I think I have almost hit the next level of mumming because Jonty has a friend who is a girl. A lady friend. A friend that's a girl.
Taney's the best mum. She lights up whenever she talks about her children. She's super proud of every single one of them, but especially Jonty.
I am blown away that we're at this stage, really. It was a milestone that we thought we may never see.
Jonty is my 14-and-a-half-year-old son who has severe uncontrolled epilepsy, and he has faced so many challenges since he was a little boy. We got told that he might not survive to double figures. So for us, every day is an absolute blessing.
What do kids do on dates now? Do they still go to the cinemas?
Well, they certainly don't use the payphone and ring the home number like I did, Marley. He got his braces put on not so long ago, and I cried at the orthodontist, and it wasn't because of the bill. It's a rite of passage for a teenager, and we never thought that that would happen for him. We are just so thankful.
Emergency services, tell me exactly what happened.
I've got hot flashes, I'm really sweaty, and I've got diarrhea, and I'm just not feeling very good.
How old are you?
40. My heart is racing.
Okay, let's organise the help for you.
RC139 for a patient with heart problem. Code 1.
So we're going to the 40-year-old female, come through with heart problems, but it says diarrhea, hot flushes and heart racing.
So if she's got some kind of infective process, we would expect her to have an increased heart rate. Yep. And feel hot.
When we're heading to someone with a rapid heart rate, we think that they're possibly in some sort of tachyarrhythmia, so their heart's beating quickly, but the patient's symptoms could be anxiety-related. She could have gastroenteritis, sepsis, but worst case scenario, she's having atypical chest pain.
An atypical presentation means different to the common presentation for that condition.
There are many different kinds of heart attack symptoms. It's not always the crushing chest pain and the jaw pain and the shoulder tip pain we hear about on the television, especially in middle-aged women. So getting to this job quickly is really important. Knock, knock. My name's Marley, and I've got Taney coming. What's your name?
Kathy.
Kathy.
So I was really sick.
Yep.
Diarrhea, hot and cold.
Yep.
Really flustered.
Yes.
Heart rate's really hard. I got the shakes.
Okay. Kathy feels sick. She's got palpitations, she's nauseated, she's sweaty, and that's something that we see with heart attack patients. So we need to get some monitoring on immediately.
At an inner suburbs medical clinic, Micah paramedics Cullen and Leonard have confirmed 71-year-old Karen's heart rate is sitting at a dangerous 180 beats per minute. They need to take immediate action to slow it down.
So our plan is to get Karen out of this SVT, or fast heart rate. We can perform a procedure called a Valsalva manoeuvre. So this syringe, I want you to put it in your mouth, okay? And then take a breath in and then blow with a tight seal around the mouth as long as possible. After about 15 seconds, we're gonna then bring your legs up and lay you back flat, all right?
Yeah. We're gonna flip her legs up to hopefully increase the blood pressure suddenly. You're just trying to go low blood pressure, high blood pressure, and the body goes, whoa, way too much blood pressure. How do I lower blood pressure? I'm gonna slow the heart rate down.
All right, are you ready to go? Yep, so hold that in, take a deep breath. Then blow as hard as you can. That's it, blow, 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 blow. Keep blowing, hard as you can, hard as you can. 5, 4, 3, 2, 1, and we're gonna go back. Relax. Here we go. Maybe, maybe not.
Nah, didn't look.
That was unsuccessful.
Yeah, I'll set up the adenosine.
Yeah.
Karen's GP tried the Valsalva manoeuvre twice, so now Cullen and Leonard must move on to administer a strong medication to reset Karen's heart rate.
So the medication we're going to give you is called adenosine. It'll hopefully reset your pacemaker of your heart, the inherent pacemaker, so that it'll then beat normally. So your heart will stop briefly. So in that period of time, which is only fleeting, you might feel a little bit of dizziness, feel a little bit strange, but just take some nice deep breaths and your heart will hopefully kick back into a normal rhythm. Adenosine actually stops your heart briefly and then restarts again, hopefully your normal pacemaker. But in that period of time where we're slowing it down and stopping it, you can feel this impending feeling of doom, like you're going to die.
Just got hot
flushes.
I can see that you're sweaty. I'm going to put the monitoring on your chest to make sure your heart's okay.
In Melbourne's southeast, Taney and Marley are assessing Kathy. They need to find out what's causing the 40-year-old to feel clammy and her heart to race.
Have you ever had an ECG before, Kathy?
Yeah, I get them done regularly because I've got a fast heart rate.
Okay. Do you ever feel faint or dizzy with your...
I've been feeling dizzy the last couple of days.
Kathy's symptoms are concerning, so I want to get the monitor on really quickly to make sure that she's not having a cardiac event like a heart attack. All right, Kathy, so this is just reading your heart. We'll check your sugars as well. Okay, excellent. Heart rate's sitting 97. Your oxygen levels are good.
6.3.
So your sugars are good. Your blood pressure is also perfect. Let me have a quick listen to your chest as well. At this point, Kathy's vital signs are good, which is really positive. Your breathing's good, but I feel like there's something else going on. So how are you feeling at the moment?
Well, I can tell you mentally I'm not.
Not feeling good at the moment? What's going on?
Just a lot of bad things happening.
Okay, tell me about those.
I just had people breaking into my bank account and they took like $3,000 or $4,000.
Oh my gosh.
Police are involved and everything.
How stressful.
And how long has this been going on for?
2 weeks.
2 weeks.
Kathy's had a significant amount of money stolen from her and she is quite distressed. It's really playing on her mind. Of course it is. It's a huge thing to happen.
I don't know what to do next.
Oh, it's okay. It's all right, Kathy. It's all right. Poor Kathy, my heart goes out to her. She's really worked up, and when you get stressed and anxious, it can exacerbate all the symptoms that you're already feeling. So it's really important that we are able to calm her down.
Back in the city, Micah paramedics Leonard and Cullen have tried a non-pharmaceutical method to lower 71-year-old Karen's alarmingly fast heart rate of 180. It hasn't worked, so now they are trying Plan B.
So we're just getting the medication ready. We need to move quickly to revert her heart rate and rhythm back to normal. We don't know how much longer she's going to have before she starts having some really serious consequences of being in a heart rate so fast. All right. Are you all ready?
Yes.
The medication they're using stops the heart for a short period before it hopefully kicks back in the right rhythm.
Might feel a bit of a funny feeling, Karen. Happy thoughts. You're all right.
It's just gone in the medication. Takes a few seconds to work.
Not yet. There we
There
go.
we go. Take a few deep breaths for us. You might feel a bit of strange feeling in your head or your chest. Your heart rhythm's slowing down. Although is that back into...
It definitely slowed down.
Slowed down. We've slowed the rate down, but I think it might still be in that racing rhythm.
Yeah,
First
it's
dose.
pretty much stuck on the 130 mark.
So it's been unsuccessful.
So we're just going to prepare another dose of the medication, but double the dose.
Now, Karen's been incredibly brave and stoic up until this point. But now that she knows we're going to have to double the dose, I can only imagine how scary that is for her to hear.
You comfortable?
Yeah.
No nausea? All right.
That's the 12 milligrams in that.
All right, you ready there, Karen? Okay, I'm ready to go, Leonard.
All right, mate. Printing. Getting that slightly uncomfortable feeling, Karen, about to come up.
Something's happening there, yeah.
Yeah.
I see her heart essentially completely stop for a few seconds.
It's looking a bit more promising this time around.
Yeah.
Beautiful.
And when it kicks back in at a normal rate. We've done it. We've reverted her heart rate back into a normal rhythm.
We fixed you. Took a little while. but we got there in the end. We still need to take Karen to hospital to work out what the cause of her heart beating so fast today was. The blood pressure's perfect.
And then I'll come back for the 8 kilometres of ECG.
There's a whole range of things that could cause it, and it could be related to having some swellings in her legs. She may have some other problems in her heart that have caused this, and they need to be investigated. Yesterday, how did you feel?
I was fine.
You could have been in this for days. You felt normal, relatively normal.
Yeah.
And didn't click that your heart was going 3 times as fast as it should for someone your age?
No.
No? OK, that's quite unusual. Karen's been a trooper. She's almost been unaware that she's had anything wrong with her, and hopefully she can either be on medication to stop it occurring again, or she can have some procedures done to make her heart normal again, so that she can live a normal life.
In the southeastern suburbs, Marley and Taney's patient has been checked over, and physically she is fine.
It's all right.
But mentally, she is having a rough time.
Got a lot of stress going on at the moment.
Kathy has recently had nearly $4,000 stolen from her bank account.
It's okay. I can tell that you're obviously stressed. What's your biggest concern at the moment?
I think I won't get any of the money back.
I think the good news is that your oxygen's perfect, your chest is clear, and your sugars are good. So all of those things are really, really good.
Yeah.
Feelings of stress and anxiety can really mimic a medical condition. You do have the real physiological symptoms that you would get when something's going wrong. So I can see why Kathy's concerned. So, Kathy, if you don't feel like you're coping, what do we do? My thought process, Taney, if you're comfortable, maybe virtual ED.
The virtual ED is a program much like a telehealth consult where we call into the local emergency department and a physician or nurse do an emergency consult, the same as what the patient would get in the hospital.
Hi, it's Taney from the ambulance. I'll just pop Kathy on.
Hi, Kathy. How are you? At the end of the consult, they determine whether the patient is able to stay at home, if they need to get medications, be seen by their local doctor, or in fact present to the emergency department.
Okay. Does that sound like a good plan to you?
Yeah.
Great. Thank you.
Thank you.
The good news is that the virtual ED doctor has worked through Kathy's symptoms and decided that no immediate hospital treatment is required. Kathy will stay with family tonight, and a nurse will stop by tomorrow to check on her.
Given Kathy's vital signs are normal and she's prepared to stay at a family member's house, we're comfortable to leave her at home. If you have any new problems that come up, if you feel sick in any other way, if you get chest pain, don't hesitate to call us back.
Okay, I'll go.
It really is the best option for Kathy, and now we're available for the next patient that needs us. Poor Kathy. I would be stressed too if I had $4,000 removed from my account.
Devastating for her.
I know. Poor thing.
I can't breathe properly.
Jade was struggling to breathe and was convinced she had COVID. But at hospital, her PCR test was negative, and it was discovered her breathing difficulties were caused by laryngitis, made all the worse by anxiety. On discharge, Jade was prescribed voice rest for a week to help relieve her laryngitis symptoms. Leonard and Cullen were blown away by Karen's heart racing at 3 times the normal rate and her not feeling a thing.
But you didn't think all this was going to happen today?
No.
At hospital, doctors discovered she has a previously undiagnosed heart condition that can cause the super fast rhythm that she had today. She's now on medication to keep it under control. There are still no answers as to how Karen managed to have no symptoms at all while her heart raced so fast. 38-year-old Michael was out for an ice cream with his girlfriend and parents when he fell to the ground, suffering multiple frightening first-time seizures.
I can see his epiglottis.
Experienced Micah paramedics Cam and Dodsey performed an emergency RSI procedure to take over Michael's breathing before racing him to the hospital. Doctors diagnosed a frontal lobe brain tumour, but couldn't confirm if it was malignant or benign until they surgically removed it a few weeks later.
How
How you doing today, Barbara? You good?
Post-operation and a 5-day hospital stay, Michael is recovering at home.
It does feel a bit surreal.
He still doesn't have biopsy results, but the doctors are confident they removed all of the tumour.
Go for a walk?
And an MRI in a few months will confirm that.
My partner and family are probably more stressed than me. I mean, I've got confidence in the surgeons at the Alfred and believing that it will be okay. Drop it. Drop it. Ready?
Michael is on anti-seizure medication as a precaution. So far, he's remained seizure-free and feeling good about the future.
So I'm just trying to accept it in my way and deal with it as I can. So I feel really calm. Like, I feel really calm about this and sort of other aspects of life as well. Fetch. To the paramedic team and to everyone else who assisted, yeah, a massive thank you, because who knows how it could have gone if the circumstances were different. So, yeah, big thank you.